Okay, so this skill that we're going to do is going to be bleeding control and shock management or shock treatment. The skill is going to focus on our tourniquets. So we have here a SAM tourniquet, we have a SWAT-T, and we have a combat tourniquet or a CAT, combat application tourniquet. We'll use this gauze. We'll talk about this when we get started. So first, BSI, make sure you're staying safe. You have uncontrolled arterial, we'll say radial bleeding. All right, so the first thing you want to do after your BSI is pressure. Direct pressure, make sure it stops. If not, you can try more pressure, but we recognized uncontrolled arterial bleed, so we're going to go right into our tourniquet. First one we're going to play with is our SAM. So we're going to take our SAM tourniquet, set up. We're going to go high and tight. Okay. So we're going to go high and tight, as high as we can. Make sure that we're not on any joints. Okay. And I want to show you how this works. We're going to pull down or away from this little tab here, and these holes have some prongs that are going to sit into there, and it's going to click when it's all ready to go. So when you pull on it, it clicks. Once it clicks, you wrap it around, you take your windlass and you spin it until the bleeding stops, not when you don't feel a pulse. Because you can stop feeling a pulse, but it still bleeds. But if you're not bleeding, you definitely won't feel a pulse. So spin your windlass until the bleeding stops. Once the bleeding stops, you tuck it in. Note the time. Now, a couple things are, you want to now make sure that you treat for shock. Oxygen, high flow oxygen, non-rebreather, 15 liters. You want to keep the patient warm, turn the ambulance heater on, give them a blanket, and positioning. So we have supine position, and there's something called Trendelenburg or shock position, which we don't do as much anymore, but just so you're aware of it, that's when the feet are going to be elevated, okay, and the patient's in the supine position. Okay, ALS treatment for shock management is going to be IV therapy with boluses of normal saline. All right, transport to a trauma center and make sure that you keep the tourniquet on. Moving on from there, one note I want to add is skill sheet might talk about pressure points, brachial artery, radial artery. We no longer do pressure points. So you can elevate, but we're not going to do pressure points. If your tourniquet fails and the wound begins to bleed again, keep the tourniquet on, grab a second one. So now we'll talk about the combat tourniquet. You apply the combat tourniquet just right below where the other one failed, and you tighten it down as much as you can. So this one, there's no click or locking mechanism. You just simply tie it, wrap it, and again, grab the windlass and turn it again. And you're going to crank the windlass till the bleeding stops. Tuck it. And note the time for the second one. Okay? If for some reason this one fails as well, for the purposes of showing you the SWAT-T, now we have the SWAT-T, and you apply a third tourniquet. Hopefully you've transported by then. But you'll notice on your SWAT-T, it shows you that these diamonds, when pulled tight, will look like a square. And that's how you know that you've pulled tight enough. So all you do is, again, make sure it's not on the joint. So here's the elbow joint. So we'll put it on the forearm. You put down the SWAT-T, wrap around, and you pull tight, and then wrap while it's tight. So you see that, and then you wrap, pull tight, and wrap. And you're going to keep doing this process until the bleeding stops. Pull tight and wrap. Tight and wrap. Tight and wrap. Tight and wrap. When you get to the end, you can just tuck this in there underneath itself. Okay, that's your SAM tourniquet, your CAT or combat application tourniquet, and your SWAT T tourniquet. One more time, treatments for shock include, BLS treatments for shock include high flow oxygen, positioning, supine or shock position, keeping the patient warm, and rapid transport to the hospital. So I just want to show you really quickly on the SAM tourniquet. To release this, all you do is you pull up against this little tab and it releases it.